Good afternoon, everyone, and thank you for coming. Can I acknowledge Di and acknowledge that it's Auslan Day today, and can I acknowledge our deaf community and all the signers out there, including Di and Fiona, as you all know. As of 8 p.m. last night, I can confirm Western Australia recorded 7,426 new cases. 2,701 were confirmed via PCR tests. The remaining 4,725 were self-reported positive RAT tests. A total of 12,712 tests were conducted at our testing clinics yesterday. There are currently 39,591 total active cases in WA. There is some good news. That is, despite the case numbers, our hospitalisations are down on yesterday, down to 215. Number of people in intensive care remains well below projections at just 4. No new deaths have been reported to 8 p.m. last night. However, sadly, 2 historical deaths were reported to WA Health yesterday. That means deaths that occurred in previous days or weeks that have been identified as people with COVID. A man in his 30s and a man in his 90s. It's worth noting our PCR testing numbers are down significantly since the same time last week. Today, nearly 25% lower. I understand that it's coming up to Easter and it's the school holidays, but it's important to keep those testing numbers up so we can have confidence about the situation and the decisions that we make. That being said, WA's COVID situation continues to be encouraging. We haven't seen a spike in daily cases recorded since level 2 public health measures were eased just under 2 weeks ago. And hospitalisations have fallen and are now stable when compared to the scenario as predicted in our modelling. Cumulative cases since the start of our outbreak are now tracking below what was predicted. And hospital and ICU admissions are significantly below what was expected. It's further evidence that our West Australian strategy of light public health measures, mask wearing and world-leading vaccination rates is working. And it vindicates measures we have used to drive our vaccination rate in WA when we were COVID-free. Our effective measures being workplace mandates, proof of vaccination for entry to venues, and delaying the border reopening to give us time to drive up our 3rd dose rate. Vaccines have slowed the spread, taken the burden off our hospitals and saved lives. This means we're in a strong position, a position to safely ease a range of public health measures as planned. And as I've always said, public health measures are constantly reviewed, and I don't want them to be in place for any longer than they need to be. So firstly, effective 12:01 a.m. Thursday, that's midnight tonight, the 500-person cap at all hospitality venues, nightclubs and function centres will be lifted, as we outlined would occur 2 weeks ago. That is what we said we'd do, and that is what we are doing. This will be welcomed by many venue owners, hospitality workers and partygoers this weekend and beyond. In addition, we can safely remove all limits on private gatherings, including at the home, both indoors and outdoors. Thirdly, given our stronger than expected performance against our modelling with regards to hospitalisation and ICU admissions, it means we're in a position to refine some other public health measures currently in place. Forced isolation for close contacts of positive COVID cases has been one of the most common public health measures to limit the spread since the start of the pandemic. Right now, WA has a broader definition than the rest of the nation with regards to close contacts. In addition to the national definition for close contacts being those in your household and intimate partners, WA currently also includes anyone who spent either 15 minutes in a confined space with no masks and or 2 hours in a room with no masks. While this was an important lesson from the East Coast experience of Omicron in slowing the spread and minimising the disruption, but now, as we ride out the height of this wave, we can now take the next step. Our encouraging COVID situation presents the right time for a change. So I can announce that as of 12:01 a.m. tomorrow, that's midnight tonight, Thursday the 14th of April, Western Australia will move to the national definition of close contacts. So only household members and intimate partners of positive cases will be forced to isolate, which is consistent with the national arrangement. This means people who also live in or stay at a residential or home-like setting, including residential care, congregate living, boarding school, or house or a maritime vessel. This means if you have spent 4 or more hours of cumulative contact without masks in one of those settings with a positive case, you'll need to isolate accordingly. This will also present immediate relief for people who are in isolation under the broader definition. This means they can leave isolation at midnight tonight, so long as they don't have any symptoms. I want to be clear, this only applies to people who are defined as a close contact because they have had at least 15 minutes of face-to-face contact where a mask was not worn with a person with COVID-19, or someone who has had greater than 2 hours within a small room with a case during their infectious period where masks have been removed for the period. To be clear, this does not apply to people who are deemed a household close contact. They need to complete their isolation period. We can proceed down this path with this sensible and safe change because with too many forced to isolate relative to the risk they pose, and parents forced to stay home when their children are declared a contact in the classroom, the cost begins to outweigh the benefit. While this will be a relief to many, it's important to keep monitoring for symptoms and getting tested if they develop. Make the most of those free rapid antigen tests we are providing to every household and through pop-up locations, or go and get a free PCR test. I also want to stress that the refined close contact definition will also apply in schools, which means schools will no longer have to, or no longer need to, contact trace classroom or equivalent contacts when school resumes for term 2. And cases in classrooms will no longer force students into isolation. In effect, when it comes to schools, if you're sick, stay home. And of course, if you have symptoms, please get tested. In addition, I can announce the requirement to test on arrival into Western Australia will be removed. However, arrivals into WA will still be provided with a free RAT test that we encourage them to use to register any positive result with health. And finally, I can announce, as of tomorrow, we will be removing all Safe WA check-in requirements around the state, except for the contact registers at our hospitals. So you won't have to check in at the pub, or cafe or restaurant anymore, but you will at a hospital. Full details of all this will be put online. But it's further evidence that as our situation improves, we are confident to keep reviewing all of our public health measures and removing them when they are no longer necessary. While it's not guaranteed yet, WA is getting closer to achieving our soft landing. It's a remarkable thing that together we have avoided mass loss of life while minimising the impact of the virus and public health measures on the community and the economy. We will keep monitoring the situation over East as they go through subsequent Omicron waves, so we can once again learn the lessons from their experiences. As we continually review and ease our own public health measures, WA has done a remarkable job, and every Western Australian should be very proud. If you haven't had your 3rd dose already, I recommend that you go and get it today. And if you're eligible, you can now walk in to get your 4th dose, or make a booking online. And just one thing before I take questions. This is the Easter long weekend. If you're working, thank you very much. If you're on the roads or relaxing at home, take it easy and stay safe, especially when you're driving. Are there any questions?
When it comes to removing the Safe WA check-in, what does that mean for proof of vaccinations?
The proof of vaccination requirement remains in place, but using a QR code when you go into one of those places, except if it's a hospital, is removed. So it removes another step, I suppose, which is no longer necessary. I do it every time I go to a cafe, a restaurant, or bar, or wherever it might be. But that will no longer be required as of tonight.
Has the Chief Health Officer said if the relaxing of these restrictions will lead to further cases and further hospitalisations or deaths? No,
we think this is the right time, and that's the advice we've received from the Chief Health Officer. We had conversations about it over the last couple of days. This is the right time to remove these restrictions. Of course, we are keeping some restrictions in place for a period of time whilst we get through this relatively, by West Australian standards, high number of cases and high hospitalisations by our standards. But it's clear that it's trending down, and our vaccination rate, third dose, continues to go up, as indeed does our vaccination rate for children aged 5 to 11. So it's the right time to remove some of these restrictions.
Given how positive the modelling is in terms of hospitalisations and ICUs, how much lower the numbers are than when we predicted, how much closer are you to setting an end date for the mask mandate, and where are those conversations at?
Well, it's not modelling. This is real-world experience. So our real-world experience is that our hospitalisations, intensive care rates are much, much, much lower than was predicted. And that's a function of the fact that we kept the virus out whilst we got to higher vaccination levels. And other states didn't do that, but we did, and that's resulted in these really quite outstanding outcomes. I think it'd be fair to say Western Australia has had the best outcomes in the world. There'd be not another jurisdiction in the world that's done as well as this state has in a health sense and an economic sense. But the other restrictions, the mask wearing and the like, we'll consider those over coming weeks as to what can be done. But that will require a vaccination rate to continue to go up, our hospitalisations to remain stable or decline, and our case numbers to continue to go down.
Is
Do
there
you
a
have a
trigger point?
specific vaccination rate?
No, we don't set exact points, because when we do and things change, then you have to change position, and it causes some consternation and some difficulties. So we don't set those exact rules. But the thing about mask wearing is it does reduce the rate of infection. It's actually something that works. And each state actually still has mask wearing requirements in place in various venues. It's just in Western Australia we have it at more venues than other states, but in effect we're going through our first wave, they're now going through their fourth, fifth waves. We haven't had the shocking experience that other states have had, where they've had masks in place essentially, I think in the Victorian situation for years. We haven't had that, so our experience is quite different, and therefore our arrangements are quite different. But as I keep saying to everyone, as soon as we can remove the requirements more broadly, or at least even in specific locations, we will.
You've said previously at a press conference, some people still choose to wear a mask outside even though they don't have to. So why not remove the mandate aspect of it and let people make that decision for themselves, seeming as cases are continuing to grow and more people are recovering from COVID?
It's a good question. Essentially what we don't want to do is what New South Wales did. So New South Wales removed the requirement and then reinstated it. I think they might have done that a couple of times, and that is very disruptive and very... What we want to do is just make sure when we remove the requirement for masks in various venues, perhaps not all, we do it on the basis that it's long lasting.
What venues would you look at removing mask requirements?
Well,
keeping mask requirements nowadays?
We're making a lot of announcements today about a lot of changes, and we'll consider all of those things in the future.
And what's the capacity at Optus Stadium that remains 75%?
It does. So the advice is it does, and you might note, and for those of you who've been to the football, the crowds aren't reaching the 75% capacity in any event.
That's not a good thing, though, is it?
Well, no, I can't make people go to the footy, but it's up to people as to whether they want to go. I think what a lot of people are deciding to do is they're not going to various venues because they don't want to catch COVID. They don't want to run the risk. And so that's perhaps why some people aren't doing it, but we're not discouraging people from going to those places. In fact, we're actually encouraging people to go out and to take advantage of opportunities, especially go to work. We're saying, please go to work. We want people to get back into the workplace as much as possible. We're doing it with state government agencies. In fact, I've even written to all the universities recently, requesting they get students back. A lot of courses don't have students in them. They're doing them online. It's not necessary. Students can go back to university. Academics can teach them in the lecture theatre or the tutorial or the laboratory environment. That is what should be occurring at our universities. And it's very difficult for students who are going to university to do their course essentially from their lounge room or their bedroom. It's not what university life is about. I just encourage the universities to get students back, as indeed our schools have. We've got all our students at schools. I don't understand why universities aren't doing it. So I've written to them all asking, because I don't control them, but asking that they get students back as soon as possible.
Do you think there's become a bit of a complacency then? On that example that you just gave, there's been a bit of complacency now around the sort of rules that we've had in place on and off for so long, particular people working from home, etc. as well?
I don't understand your
Become
question.
accepted? It's become a practice
okay.
almost.
Yeah, well, it shouldn't be. I just encourage people to go to work, and students to go to university, students to go to school. We don't need to be reticent about those things now. Now, I know technology has changed over the years, and you can actually do meetings via Teams, and you can do all those sorts of things online. But there's something about going to work that is collegiate, and it ensures that our CBD in particular has people in it. And we just want as many people to get back out into those environments as possible.
Do you accept that mask wearing is a big reason that people don't want to go back to the office?
Not really. Not really. People understand the requirement for mask wearing. They understand why it's there. And it's designed to reduce the spread. And it's worked effectively. I think what is the case is some employers are saying they're not requiring their workers to come to work. I'd encourage them to move away from that. And if their employer is saying you don't have to come to work, I suppose some workers are saying, well, I won't. But I just encourage employers across the board to get people back to work.
Understanding why it's there, though, is different than sitting in the office for 8 to 10 hours a day wearing a mask. Some people might choose to stay home for that reason.
I think broadly people understand why it's there and support it, and many people would still choose to do it even if it wasn't a requirement. But it's a health and safety requirement at this point in time, and as soon as we can remove the requirement, we will.
The
Some of the AMA
two square metre rule, is that 2 square metre rule still in place?
It is.
That's been one for some venues that might have, say, less than 500 people, so the cap doesn't actually apply to them, but they're still restricted in a way by the 2 square metre rule.
It's not a significant restriction from the overwhelming majority of venues. It's still in place because it's an important measure to reduce the spread of the virus. But I think most venues will cheer today that the 500-person cap has been removed, including for nightclubs, and that the QR code check-in arrangement has been removed. And obviously, if you want to hold a party at home or function at home, the limits on the number of people who can come to your home has been removed. So they're pretty big changes we're putting in place today.
QR check-in removed. What's the future of G2G passes?
That remains in place at this point in time because it's a vaccination requirement and allows us to check those things. As you might know, we don't have the numbers of police at the airport checking these sorts of things as we used to. It's much reduced, but it remains in place. Obviously, at some point in the time in the future, we'll consider that matter.
So
What about
lifting
proof of vaccination requirements themselves?
They remain in place. So the things that have worked most effectively during these last 2 years, and I think I can say this with some confidence, having been through it for the last 2 years, was the border, kept the virus out whilst we got vaccination rates up, and the vaccination rates have driven the best outcomes in the world in Western Australia. The best health outcomes and the best economic outcomes in the world. So getting the third dose vaccination rate up continually is important. Now we're currently at over 77% third dose. It climbs every day, but we've got to continue to get that third dose vaccination rate up. Our first and second dose rates are somewhere around 99%, so highest in Australia, perhaps highest in the world. Our third dose vaccination rate is the highest in Australia, and certainly the highest amongst the people who are eligible by a long, long way. And that's driven these remarkable results. So our hospitalisation rates are low, our ICU rates are incredibly low, and that's compared to other states. And there's one reason for that, the fact that we got people vaccinated.
How do you keep falling testing rates high as things are relaxed more?
Well, I stand here and I encourage people to get tested. We provide free rats to people so they get tested. Only state government in Australia to do that. So our PCR clinics are open, they're free, they're available, they've got lots of capacity. Free rats are out there, we're providing them as many places as we can so people take up the testing opportunities. And there's not a great deal more that can be done, but I might add, providing free rats to people across the state is more than any other state government has done.
Will mask wearing remain until the end of winter?
I can't answer that question. We'll review it in coming weeks.
Is
Do you
there any
believe
scope?
that masks? Do you actually believe that masks actually makes workplace more comfortable, more people actually go back to work? Because there's a very interesting argument from the AMA says there's other surveys in the East Coast saying that people are actually more comfortable to go to work because they wear masks.
I hadn't thought of that, but that's a good point. I suspect there are some people who are more comfortable because they know that they are having the prospect of catching COVID reduced. when they go to work because people are wearing masks. But it's probably an individual thing for individual people as to their attitude to these things. But just so you understand, if you're in an office on your own, you can take your mask off. It's really only when you're interacting with other people that you're required to put your mask on.
What did you make of?
Is there any scope to potentially adjust some of the elective surgery bans given hospitalisation numbers?
Yes, so we're going to move to get as much elective surgery back as we can over coming weeks. At this point in time, one of the biggest issues is the furloughing of hospital staff. So last week we had 2,500 or thereabouts hospital staff furloughed because they were either COVID positive or they were a close contact. So the changes we're announcing today will mean there'll be less people furloughed and therefore more people able to work in our hospitals. Therefore, over coming weeks, we should be able to lift the elective surgery rates up progressively. Now, I look forward to doing that, but it's not an overnight thing. It'll take some weeks to achieve.
Do you have any detail on how many close contacts are isolating at the moment?
Did I?
Is there any sort of estimation as to how many people will be freed at midnight tonight?
No, I can't, because we've got so many thousands of people. There's not a system by which people go, police or what have you, go and check on people. You might recall last year that was the system, but that's not our system now because it's not actually possible.
On the health staff though, would it be potentially a majority that are being furloughed because of being close contacts rather than positive cases?
I don't know the answer, but obviously if you're a COVID positive person, you stay home.
Should somebody running for Prime Minister know the national unemployment rate and the cash rate?
Look, what was that, 2 days ago? Anthony Albanese admitted he made a mistake, which was appropriate. Obviously, when you do a press conference, you can get asked anything at any point in time on any subject matter. And sometimes you might have a mental blank. I do recall John Howard had that happen to him back when he was Prime Minister. It happens to people.
Pretty big mistake though. Are you worried it's damaged Labor's chances of winning the federal election?
Look, sometimes you have, I don't want to be repetitive, but sometimes you do have mental blank and you're standing there with, probably in his case, 15 cameras and 30 journalists asking him questions on everything and sundry. And on one occasion, he forgot a couple of statistics. Now, personally, he made a mistake. I make mistakes. We all make mistakes. But what you do is you learn from them and you move on and you recover. The key to being successful in politics is resilience and hanging in there when things get tough. And I know that Anthony has resilience in spades. He has resilience. And resilience, toughness and ability to overcome mistakes is important, and that's what you want in a political leader.
The economic decisions of the Commonwealth governments obviously affect the state. Are you confident that he has the economic credentials to lead the national economy?
I actually do. He's very mainstream. I think what you've seen with Labor governments across Australia is we know how to manage economies. My political heroes back from the 1980s and 90s, the sort of Hawke Keating era, they knew how to manage the economy. What you've seen with the current Commonwealth government is, and I don't think this is commented on enough, is a sort of a national debt going from 250 billion to 850 billion in the course of 8 years. It's a pretty big deal, and I think it should be commented on. And I don't really understand why. Those questions aren't more asked of the Commonwealth government. I mean, look at this government. We pay down debt. We deliver surpluses. We create jobs. 152,000 jobs since we've been in office. 4.1% unemployment rate. Highest participation rate in history at over 70%. Diversifying the economy in all sorts of areas. When you're mainstream, you work with everyone, that's the outcome you achieve. I'm sure Anthony understands those lessons.
What do you make of public submissions on how to commemorate the Bayswater Bridge? Someone suggested you drive a wrecking ball into the bridge to symbolise a better future for Bayswater. What do you think?
A wrecking ball? I'm not understanding. So what are you suggesting?
So there are public
to knock it over?
Yeah.
Right.
Knock it over, so it'll be demolished at the end of the year.
Well, it's caused a lot of grief. It's caused a lot of grief over the years to a lot of truckies. So you probably get a lot of truck drivers along there with some dynamite to blow it up, and that would be their revenge on that bridge. Although
No.
I probably wouldn't recommend that.
No,
don't do that. Don't do that. Maybe we'll just go for more conventional techniques, whatever they are.
Just for those who aren't familiar with the East Coast definitions, do you mind taking us through again the handful of ways you can still end up a close contact?
Yes, it's for people who are household contacts or intimate partners. They are the people who are going to be a close contact from this point forward. So all of those other contacts, which are your 15 minutes face-to-face contact without a mask with someone, or sharing a room with someone for 4 hours in a workplace or whatever without a mask on, or kids in a classroom without masks on, particularly your K-3 kids or whatever, that's no longer going to be a close contact. So the national definition is essentially household contacts. So if you live with someone, you share a house with someone, if they're your intimate partner, if you're sharing a boarding room with someone, that's counted, and they will be the people who are close contacts from this point forward.
Kununurra is experiencing a major crime wave at the moment. Are you aware of that?
I am aware that there has been some issues and that the police are dealing with them.
Will there be measures in the state budget to assist further for those communities?
There will. As you know, we're employing an additional 1,100 police officers, and we've sent a team of police officers up recently to the Kimberley to try to deal with some of the issues. But we're going to have a broader package of measures coming forward, which I think we've mentioned some of them already. So the Target 120 the Target 120 initiative, which works with families, particularly to ensure that they have, if you like, some support and education in raising children. That will be rolled out in the Kimberley and other areas around the state. We're going to look at alternative sentencing options, in fact implement some in the Kimberley, and provide opportunities for sentencing on country rather than the removal, particularly of children, to Banksia Hill. A range of initiatives like that designed to try and break the cycle. Now the cycle of antisocial behaviour and crime is hard to break, but looking at doing innovative and new things has to be a part of what you do. We roll out additional police, we roll out additional law enforcement, but you've also got to roll out things that help families deal with, in particular, children and in a constructive way, and also ensure that we have those on-country sentencing options.
So would you consider now, given that you're talking about different ways of looking at the alcohol sales in those regions, that the Police Commissioner is very strident on?
Well, individual communities can put in place rules, and a lot of them do. Some of them have bans on alcohol sales, some of them have restrictions on how many drinks you can buy, some of them have requirements for light alcohol. That's all in place at individual community level across Western Australia for individual communities to make those decisions, which is essentially self-determination. We're putting in place the banned drinkers register in various parts of the state, which ensures that some people can actually be banned from going and buying alcohol. But banning alcohol sales in Broome or Kununurra or Headland or wherever it might be, that's not something we're going to do.
Some businesses have talked about a curfew maybe in the town. Would you support something like that?
Those sorts of things are put in place on occasion, dependent upon activity and what occurs. So the police do actually do that on some occasions. If there's some sort of antisocial behaviour, they will close the bottle shops, put in place those sorts of measures. But putting them in place permanently, I don't think is something that we can implement either.
If crime remains out of control in the northern areas, would you send more resources up there?
Well, that's what we've done.
Just back on COVID, where does it leave high-risk people in terms of them being more vulnerable to catch it from medical staff who would have otherwise had to isolate?
Well, the close contact definitions we're putting in place require anyone who would have been in close contact or is symptomatic not to go to work. So if you're symptomatic, you should do a test, and if you're unwell, don't go to work. So that's what's in place. And we have our actual RAP program, particularly with our health staff, which is extensive and very, very wide access to testing. So that's already in place. But we actually need staff in hospitals as well. So if you're COVID positive, you don't go to work. But if you're a close contact today, tomorrow, the chances are you won't be. and that means you can go to work and we can actually have staff back in hospitals.
For visitors to hospitals aged in disability care, do those restrictions remain?
Sorry, which
The
restrictions?
restrictions on visitation to hospitals and aged care?
Yes, they do. At this point in time, they do. Obviously, we'll consider that in the future, but they're kind of they're important for preserving the health of people in hospitals, aged care, and disability homes. The only thing about them is they can be tough, particularly for families, particularly for people who might be near the end of their life. Hospital staff and our aged care staff to implement them in a very considered and compassionate way. And so we're looking at how we might be able to make them more compassionate in the future. I hate these stories of people who are near the end of their lives and restrictions on them seeing their families. So we're trying to make sure they're implemented as in as compassionate and sensitive a way as possible, with some flexibility for people in those situations. Thank you very much.
Thank you.
Thank you.